Did you know that unbearable pain caused by an acute fissure can be instantly cured by a very simple procedure? This is Dr. Ravindran Kumeran, surgical gastroenterologist, Apollo First Med Hospitals, Punnamalai Road, Kilpauk. So there is a myth in the community. People assume that they got piles when they have a pain in the anus. Anybody with severe pain in the anus would say, I've got piles, and they come to the hospital saying they've got piles, which is often not the case, and it is usually because of a condition called as an anal fissure. Anal fissure is a very simple, straightforward problem. It is a tear in the anus. So anus is made of muscles and is covered by skin. All of our anus are the same. So if the skin is stretched beyond a point, it has to tear. There is a tensile strength. If you stretch it beyond a point, it will tear. So if you have a very hard stool coming out of the anus, then the skin gets stretched beyond a point and it tears. The tear is referred to as a fissure, and it's an extremely painful condition. It is equivalent to having a small piece of dust in the cornea. Cornea is the black of your eye. So if you have a small piece of dust there, it often gives rise to terrible trouble. You are unable to open your eyes. Similar phenomenon, if you have a small tear in the anus, that gives rise to disproportionate unbearable pain, and the patients will often say they are not able to go to the toilet. They are scared. It feels like they are passing broken glass pieces when they are going to the toilet, which is literally what they actually feel. So why does this happen? There are muscles around the anus which goes into spasm. What I mean by spasm is they become very tight. Like how when you have a foreign body in your eye, people will often say, open your eyes, let me see if you got a foreign body, but you are unable to open your eyes because it involuntarily closes. It is out of your control. Same way the anus does that. It becomes very spasmodic, very tight, and the patient is unable to comfortably go to the toilet. It is not only the only symptom, sometimes patients do have bleeding associated with it as well. So the diagnosis is very often, you hear the patient telling the history, you will know what is happening. The patient will be petrified about the idea of you examining. If you say, let me have a look and examine, they will say, doc, please don't, because it is extremely painful. So often you do not put your finger in and examine. You just split the anus and you will be able to see the tear. You do not have to put your finger in because the patients will become very uncomfortable. If you see a tear, then you know that is what the problem is. Acute tears are patients presented to hospital immediately after the tear, within a day or two. Treatment is often medical. If you give appropriate medicines, patients will become better, but it will take its own time to become better. If you want an instant cure, if the pain is so unbearable, then there is a very simple operation which can be done, which will get rid of the pain like in an instant. So you go into theatre with a lot of pain, and when you come out of theatre, you feel that you're completely in a different space. You do not have any pain at all, and the next morning bowel movement will be normal without any pain. So patients who have unbearable pain do qualify for that surgery. And then there is a chronic fissure patient. Patients who have had symptoms running over months, if not years. They have seen several doctors, they've had several sets of treatment in the past, and they have a non-healing deep fissure. Now the pain can be bad on spells. So you have good days, you have bad days, you have several months which are good, and suddenly you have a flare-up when you have pain for a week or so on and so forth. Often these patients require surgery because these fissures do not respond well to conservative treatment, meaning medical treatment. So if you have pain, please don't assume you've got piles. Piles often is painless, especially bleeding piles. Internal piles do not cause any pain at all. Severe pain is often a fissure or sometimes even an abscess. So please consult an appropriate surgeon to be able to know what the problem is, and often treatment is very straightforward. Thank you.